Good afternoon, everyone. I'd like to call to order this, wanted to say episode, I'm not sure what the right word is, for the Jail Oversight Board. If we could all rise for the Pledge of Allegiance.
The flag of the United States of America.
And individual
Liberty.
I'll begin by announcing that we had an executive session yesterday to cover matters of public safety regarding personnel. The next item for today is, as always, the first round of public comments. We'll have two. The first is for items specifically on the agenda for today. And if there is anyone in the audience who would like to address the board, please do so now. Hearing none, the next item is the approval of the minutes for May. Do we have a motion to approve?
Make a motion.
Thank you, Ms. Love. I think first, second.
Second.
Thank you, Mr. Lazarus. Motion is second. Any questions or comments on the minutes? Hearing none, all in favor? Aye. Any opposed? Guys have it. Also mention that with us today via virtual is Judge Whalen, Judge Brennan, King. I believe that is it. Next item for today is an approval of the May reports. Motion to approve the reports.
I'm making a motion.
Thank you, Judge Whalen. Ms. Love, motion is second. Any questions or comments? Hearing none, all in favor? Aye.
Aye.
Any opposed?
Aye.
Okay, any opposed? The ayes have it. Next is Warden. Warden Williams.
Good afternoon or evening, members of public attendance. I would like to start this month's Warden's report with an introduction. So during a special meeting, this was an item for discussion in regards to a contract for Deputy Warden. And today I have Deputy Warden Michelle Miller present with us. I've asked her to introduce herself and say a few words. Before she does join me at the podium, I wanted to talk just very briefly about the fact that she's come to us. She is working diligently. She hit the ground running. I was actually, unfortunately, out of office for her first day, but has been working extraordinarily close with the rest of the deputy warden, as well as the main. Has done an extensive job and review already of baseline understandings of where our facility sits today and security measures. Already engaged in multiple process improvement. We are extraordinarily lucky to have her on board. Appreciated all of the insight and support provided thus far and are looking forward to the next couple of months. So with that, I'd like to introduce Deputy Warden Miller to
prior to visiting, not have about the county, but I am so impressed how friendly the staff are, how friendly you guys have an absolute come here, not well known to us and that live. So I have been with you for now. Appreciate the environment at the facility. I've also staff have been about area policy practices, assessment, really delving into the entire facility and the security of the facility. I've had the opportunity to spend time with all of the shift commanders, and I'm starting to work with the shift sergeants in detail. And I think that's very important to know where they're at as far as security goes, where they're at as far as their shift command practices and procedures, and how we can improve the institution moving forward. So thank you very much for the opportunity. I appreciate it.
I also wanted to acknowledge Delco CPR scheduled a visit. It was originally postponed, but we were able to have them on site. Councilman Madden, you were also present for the initial meeting that we held in the conference room, and then we conducted a tour of the facility as well. So I just wanted to make sure that that information was known to those that might be watching at home, that the groups that were invested in deprivatization from the start have continued their investment and followed up on the promises and commitments that they've made in terms of holding us accountable throughout the transition process and checking in to make sure that we are doing what we're saying we're doing.
Yeah, and I'll just add my welcoming to Deputy Warden Miller. I appreciate your joining us in Delaware County, and as we are certainly at a place where we know that there's a lot that we must still be improving upon, it's great to have your experienced, fresh set of eyes with us here in Delaware County for as long as you'll be with us. So thank you for joining us. And as you said, Warden Williams, we had a great meeting with Delco CPR yesterday, and I echo your appreciation for their involvement for several years now, and hope to continue that outside-inside partnership as we transform our prison, or jail, I should say.
Thank you. I'll begin the warden's report with the coronavirus update. In the month of May, 135 incarcerated persons were tested utilizing PCR tests, and one was diagnosed as positive for COVID-19. We have struggled to obtain the data related to vaccinations prior to the transition because that existed in the previous healthcare record. So the numbers that we'll be reporting are not necessarily representative of the entire population currently in custody, but each month we will be able to report those that are committed to our facility that are either fully vaccinated or partially vaccinated. So in the month of May, we had 175 new admissions that were fully vaccinated for COVID-19. 49 were partially vaccinated for a total of 224.
And Warden, that's out of how many total people taken in?
So we had in the month of May total commitments, one moment, 537. So I did not do the percentage. I can maybe work that out, though. Our controller's here, and she's really good at math, so maybe she can help me.
That's right.
We had 0 vaccinations completed within the facility walls in May, and we are working currently with WellPath, our contracted provider, to make sure that we do provide a clinic in June. They are committed to doing that. We've put out education to the incarcerated population that's on the housing units to hope to get increased interest in vaccination. Today, our facility has 1 positive case for an incarcerated person. In May, we had 14 staff members that tested positive. So when we saw the spike in the county, that was also reflected within our employee base. And currently, we have 1 staff member that is out in their recovery process. I think we're all aware, but just to make sure that it's known and on the record, Delaware County remains in high transmission levels for COVID-19, and the facility is currently abiding by recommendations by suspending visitors and volunteers at present time. This will be reevaluated when the transmission level is decreased. Though not specific to George W. Hill, I wanted to utilize the opportunity to talk about the efforts that were recently announced by the Delaware County Health Department. On June 8th, they released a statement that there is a new COVID-19 testing site in the parking lot of the Delaware County Wellness Center at Yaden at 125 Chester Avenue. They provide free walk-up and drive-through COVID-19 testing. And though appointments are not required, they are strongly encouraged to make sure that you can be seen timely. It was interesting for me to learn that they offer both rapid antigen tests, which provide results within approximately 15 minutes, as well as PCR tests. And because they're able to process those samples on site, they can get the results to you in less than 24 hours. So as transmission rates are continuing within Delaware County, it's important to test if you have symptoms, and there are opportunities to do that. Hours of operation are Mondays, Tuesdays, Wednesdays, and Fridays from 8:30 a.m. until 3 p.m., and Saturdays from 9 a.m. to 1 p.m. They are not operational on Thursdays and Sundays. Additionally, this site provides COVID-19 vaccines. They will do initial vaccinations as well as boosters, and you should schedule those appointments online. The Delaware County Health Department website has a lot of information related to these efforts, and we do partner with them to make sure that we're making the right choices for our facility as well as the safety of those in our custody. I wanted to also take the opportunity to acknowledge and recognize our 2 employees of the month for May of 2022. This month, we are celebrating, these are employees of the month for June. And we are celebrating and recognizing the extraordinary efforts of 2 of our employees, Officer Alan Dua and Maintenance Technician Joe Grosso. Officer Dua works diligently to increase safety standards within the facility. He has exceptional situational awareness and has been one of the individuals responsible for recovering large volumes of contraband throughout the facility. Because of him, the population and our staff are safer. We appreciate his diligence and commitment to this, as well as his enthusiasm in working with some of his peers so that they also can learn from some of his skills that he's adapted to over the years. Maintenance Technician Joe Grosso has been tasked with multiple projects as we continue to identify areas of opportunity within the facility. His supervisor notes that he's been critical to his support and transition to the facility, and Mr. Grosso has also worked to assist in the training of another new maintenance technician. This department is still operating with vacancies, and all of the staff have been dedicated to their duties to make sure that they're keeping up with work orders when they are submitted so that they can offer timely response to our facility needs. In the month of May, we also provided recreation or out-of-cell time every day. And that is so important that we've been able to sustain those efforts. I know that that was a heightened area of focus and opportunity prior to the transition. There were 3 total shifts in the entirety of the month where recreation was not provided to the full population due to security incidences. The population was, however, afforded recreation opportunities on either the day or evening shift of those dates, but not both shifts because of an incident that was going on. The agency was increasing a recreation to the point where we were allowing full blocks to come out, so the entirety of the population of their cells was permitted. However, we did halt and reduce the numbers that are permitted to be out of cell at one time due to the rise in COVID-19 transmission rates, and that is consistent with mitigation recommendations and measures. Our current population is 1,281 incarcerated persons. Accounting for that, we have 1,084 males, 146 females, and 43 lodgers. We also have 55 persons that are currently in custody and sentenced to a state correctional institution, and we are working with transport teams both from the state's admission levels as well as our sheriff's department to get those individuals transported so that they can complete those sentences. We had 537 total commitments and 527 total discharges in the last month. Though it is not covered within the reporting period, I think that it is important to acknowledge that on 6/4, June 4th, we did have a sentinel event within the facility on housing unit 10 Alpha. We had a loss of an incarcerated person's life. A 34-year-old white male was found unresponsive in his cell. And despite efforts of on-site responding staff as well as community emergency medical response teams, the individual never regained consciousness and was pronounced dead at 13:48 hours on that date. Next of kin, which was both his mother and father, have received information related to this event and have spoken directly with our staff, including our chaplain department. Our agency is coordinating with the medical examiner's office, and this is under investigative review. So again, though it was not within the May reporting period, we wanted to make sure that we had disclosed that information in recognition of the individual who lost their life. On Friday, June 17th, we will have 8 more cadets graduate and join the rank of officer. And to reflect on the staffing efforts and improvements that have been made from April 29th until May 27th, we had 39 officers successfully complete the Cadet Basic Training Academy and have effectively added to the employee roster. We currently have 13 officers engaged in the Cadet Academy that started their training on June 6th. And we have 21 cadets anticipated to begin training on July 7th. We are continuing to recruit for individuals to join the ranks of George W. Hill Correctional Facility and hope that interested applicants will apply. We do pay employees for their training, so you go through a cadet academy on site within the facility. You're working with professionals. We do on-the-job training. You are paid as an employee from the start. And then before you will get issued your uniforms as well as other equipment that might be necessary to perform your duties. There are a number of extensive benefits that we provide to our employees, and we would like to continue to build the team at George W. Hill. The last item for my presentation is a proposal. And I want to acknowledge that last month I had made several proposals and presentations, and one of the outstanding items that I was to provide additional information for was related to the chairs. So I have attempted to get a sample chair delivered so that we could actually put eyes on. That was unable to happen, and the price quotes have effectively expired. They were, within a timeline. So we are working to get additional quotes, make sure that we have a vendor that can provide the supply of chairs that are needed, and I will get that information to the board as soon as that is received. But for this evening's consideration for inmate welfare expenditure request, we are proposing the replacement of sheets and blankets within the entirety of the facility. And we reached out to multiple vendors, and though they have different names for what the blanket is referred to, and you might see the different references within the proposal that was sent to the board prior to the meeting, they are all the same thing. And I brought a sample with me, and Deputy Warden Falley is assisting. So this is what we would call a tamper-resistant blanket. Beyond being tamper-resistant, it also is a substantial blanket. It provides warmth to an individual. You can see in length, it covers, somebody who might have a higher, they are a taller individual, so they might need a little extra coverage. And this is something that we are proposing utilizing within the facility as a mitigation risk measure and also to enhance safety measures within the institution. Now, you can see that it is a little bit sturdy at present. It is malleable, but once it's laundered several times, it does loosen just a bit, but it still remains tamper resistant. It is quilted and reinforced with threading to make sure that it will, definitely withstand the laundering process as well as wear and tear. And it will last significantly longer than the sheets and the blankets currently do, which requires a lot of replenishment just out of the daily use. Additionally, we see a number of individuals within the institution that will modify or adapt property, which is not permissible, and we did discuss that last month in terms of the restitution fees when somebody completes property damage. So we do not want people to be able to create clotheslines out of their sheets or manipulate items in any way that might increase the risk of harm to self or harm to others. And though we can't change the entire facility, there are some steps that we can make to increase safety measures. And this is one that we can enact pretty immediately. So the vendor that provided the lowest bid, and this is a sample from that vendor, is able to fulfill based on supply, current items in stock, an initial order of 500 blankets so that we could make sure to get those to the highest risk areas in which we would like to implement this first. And then as they are fulfilling the remaining order, we can roll that out to the rest of the facility. The benefit of this phase program is that it will allow us to also see what changes may need to be made, if any, to our laundry process in terms of schedule. Because they are substantial, they do take a little bit longer to dry at times. So we'll be able to modify as a facility as well. You can see that the quote, and I had provided the electronic copy to the board, which can also be posted obviously online, includes all of the different bids that we had received, and the total request would be $317,000, or sorry, $317,900 for the full implementation to cover the facility, as well as having an additional stock on site. And we are making this request to come from the Inmate Welfare Fund as it directly relates to all inmates within the institution instead of the operating budget. So I'd love to entertain any questions or comments that anyone on the board might have.
Questions or comments from the board?
I just had a question. It was great that you got the written bids. I guess as we're doing the transition, we're working through purchasing issues and working with central purchasing and the facility. I know we have our administrative code provisions, so I saw the written bids and I assume that's just something that we're still working through, getting through a lot of these processes. So, I'm supportive. It seems that we need this, and I think using the inmate welfare fund is appropriate for something that's benefiting everyone in the facility.
We are committed to continuing to work through the Delaware County processes. I think we're all still navigating those waters as we're getting situated in roles, but
Right.
thank you.
Other questions or
Warden,
comments?
I have a question. Yeah, I do.
Yes,
Thank
Your
you
Honor.
very much. How does the welfare inmate fund get replenished? Seems like we're going through a lot of money lately.
So the Inmate Welfare Fund receives different deposits from the commissary account. So as individuals
Okay.
are spending money, there is a percentage or a commission rate that funds the Inmate Welfare Fund.
Oh, okay. Thank you. The other thing, I'm looking at this wrong, but I'm getting 38,900 and then 310, which would come out to 348.9.
So the 310 quote is for the full 5,000. We were waiting for them to send the revision. So on the actual face sheet, you'll see that it's reduced from 500, which is the initial order, what is currently in stock and available. And then the second item is 4,500. The 310 is a quote for 5,000 blankets. When we do get that revised quote that reflects 500 and 4,500, I can resubmit those items for the total.
Well, that's not necessary. That explains it. Okay, thank you very much.
No problem.
And Warden, just to the judge's question, do you want to give an update on what the balance is for the Inmate Welfare Fund, if you have that?
I
roughly
didn't
available?
bring it, but I think my trusty deputy warden might know.
Yeah, so currently we are expecting, we have two commissions that we are waiting for to be deposited from Aramark, which should average around 40,000 each, and we should be just at 3.6 million.
Warden, can you just repeat that for the audience at home?
So we are waiting for two more commission deposits from Aramark related to commissary. But with that averaged out and the projected, we will be at $3.6 million in the inmate welfare account.
So even with this expenditure, we would have a pretty significant balance that still remains to be put toward the welfare of the inmates, which this certainly would qualify for.
Yes.
Yeah, okay. Thanks. Sounds reasonable.
Any other questions or comments from board members?
Will we be making a recommendation to council for that?
Yeah, so that was really the question I was going to ask is just procedurally, given the fact that this is coming out of the Inmate Welfare Fund as opposed to the general fund, I'm not sure if our solicitors or if the executive director has a view on whether we even need county council input here, or if this could be an action that could be approved exclusively at the discretion of the Jail Oversight Board.
Mr. Chair, my thought is that the code's not specific as to source of funding, so that any procurement that exceeds the the $25,000 statutory limit has to go to council.
That's unfortunate. I'd rather we be able to move forward with this purchase as soon as possible, but well, if that's the answer, then that's the answer. Can we perhaps approve this conditionally, such that if upon further look we determine that it doesn't need county council approval, then we can expedite the acquisition? And if you're in fact, your instincts are correct, Mr. Lazarus, then we'll put this on for the next meeting, for the next county council meeting.
Mr. Chair, I think if you believe it to be a matter related to safety and health, maybe you could go through the initial purchase and ask council to ratify it. But I'd rely, as always, on the voice of the solicitor in that regard. But if it's an immediate safety issue, based on the unfortunate instance we've had with people using linens, I'd be willing to bring it to council to ratify the initial purchase and then approve the larger purchase.
Madam Solicitor, do you have any?
Yes, I think either of those approaches would be appropriate, either to approve it. Good afternoon, Shelley Smith, Solicitor to the Jail Oversight Board. I think either of the approaches that you and Mr. Lazarus have proposed would be appropriate, either to approve it conditionally, subject to a review of the necessity of council's approval, or to approve it as an emergency expenditure and have council ratify it. I think either one of those would be appropriate.
Okay, I would advocate for the latter unless there's disagreement on that front.
Yeah.
Okay, so we'll approve this recommendation and recommend it for emergency acquisition for county council.
I can certainly work with Warden Williams on putting the item before council at his next meeting.
And I will additionally add, because that was a clarifying question of mine as well, we had discussed the out-of-cell recreation activity fitness centers, as well as the pull-up bars. That too needs to go before council based on what I've just heard reasserted today. So we can put all of those together, and I will ensure that that happens. But in the interim, I would appreciate the emergency approval.
Yeah, and I don't think those two would really be emergency.
No.
But this, I think, should be expedited. So with that, is there a motion to recommend the purchase?
I can make the motion.
We have a motion and a second. Any further questions or comments on this recommendation? Hearing none, all in favor?
Aye.
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 Any opposed? Okay, the ayes have it.
Thank you very much. At this time, I would like to welcome Deputy Warden Falley to provide the report regarding programs and support activities in the facility. Thank you.
Thank you, Warden.
Thank you, Warden. Good evening, Jail Oversight Board. How you doing on this beautiful Tuesday? For the month of May and June, the month of May, we spent a lot of our time preparing and enhancing our program to see what do we need. For the month of May, I sent you guys the data last Friday. I'm not going to go through it in details, but I'm just going to highlight some the programs update. For our GED education development, we had 29 participants. Out of the 29, 20 tested and only 3 passed the GED, for a total of 20 incarcerated people in Delaware, George W. Hill received their DEG education. One of the things that we are enhancing is our tablets-based program, in which Kelly Shaw, our program reentry administrator, will talk more about it later on. We added some component from PennDOT regarding the CDL driver manual. Our substance use disorder, Patty O'Connor, our administrator, is working on enhancing our substance use program. Currently, we have an increase on the dosage of Narcan, 289 we distributed. And I'm very proud. Thank you to the intake department, LT, Moore, Sergeant Andrews, and everyone in there for their support. For prep, we extended prep. We have total 53 participants who completed prep program, 41 prep 1, 22 prep 2, and we have 23 new enrollment for the month of May. As far as religious services, when we started in-person religious service, we had 320 masses and 19 in-person religious services. And then we had 6 family death notification. Death notification are pretty much a family member that passed away, and Reverend Dunn was very busy in the month of May, providing arrangement and grief counseling to our incarcerated person. Threshold, we had 12 participants in threshold, and 2 of them completed it. Threshold is a 6-step, 7-week decision-making program, which is organized by 6 different it's a 6-week decision-making program organized by 6 complementary micro meetings in the visitation room that we do. Wellness. We started our wellness program, and we had 9 juveniles that participated in the wellness activity, as well as 38 adults for the month of May. And Ms. Shaw will come and talk about the VIA path and the reentry.
Thank you, Deputy Warden. Good afternoon, members of the board. The ViaPath technology update. We continue to offer video visits, and as the warden mentioned, May 20th, in-person visits were halted. We have extended the go live one-to-one implementation of tablets. It is imperative that we're set up for success, and the extension allows for the inventory and accountability process to be finalized. Security staff and all male staff have completed tablet training. The tablets have all been provisioned to appropriate housing units, and the access points have been replaced and are up and running. The Adivo Education Learning Management System is up and running on the tablets. The Adivo Education offers over 20,000 hours of free learning content in academics, jobs and finance, health and recovery, arts and culture, reentry, and spirituality. 83 learning courses have been successfully completed for the month of May. Post-release, reentrants can continue progressing through the Adivo Education Learning System. The post-release service of continued learning is of no charge. Reentry update. For the month of May, 16 sentenced incarcerated persons were released, all accepting service from the reentry case manager, which included 5 completions of the COMPASS application. COMPASS is public assistance for healthcare, food, and nutrition, which activates the day of release. Community service provider work readiness workshops are on hold due to the COVID uptick in the community. And in the interim, the Adivo educational system provides 70 career and finance courses. Pre-transition, Councilman Madden and his executive assistant linked a request from Penn State Brandywine. With your recommendation, Mr. Madden, we are close to implementation. Penn State Brandywine will be hosting a public speaking college course on site for the fall 2020 semester. And here's a few details about the program. 10 college students and 10 incarcerated learners will meet weekly on site to learn how to effectively public speak and craft presentations for a target audience. Upon successful completion of the course, incarcerated learners will earn 3 college credits to Philadelphia Community College. Philadelphia Community College has a reentry division with dedicated staff to best serve reentrants. And lastly, I would like to thank Mr. King for his outreach and connecting the reentry team to additional reentry field experts. I look forward to further conversation and potential collaboration with the field experts. Thank you, Mr. King. Thank you.
Thank you, Deputy Warden Shaw. Any comments, questions from the board?
Yeah, I have a question, and maybe for the warden, and, but in light of, that with the visits shut down and because of COVID, and rightfully so, if something changes before we meet again, will the warden have, discretion or use her judgment as to whether to lift it? Does she need to wait for us? Because I'd hate to have to make people wait for us to have a meeting when the health department changed the level of alert on COVID.
Yeah, but my personal view is that we're following the guidance of the Public Health Department and the CDC. And so I think so long as this board is giving the direction to the warden that we should continue to follow that, whether it means an increase or a decrease in access, I think that's sufficient.
That's what I would advocate for, because if, you can get the volunteers and workers back in to end their visits, I would think that has to be helpful for them.
Correct.
So,
and I believe that's how it really occurred with regard to this, temporary suspension of in-person visits. That happened without jail oversight boards.
it has, but in the past, we also voted to stop visits. So
Understood.
I just wanted to be clear that you have the authority to do that.
Yeah. So unless anyone disagrees on that, I think that's
Okay, great. And then the only other thing I was wondering is there any way that we can get our health department to help you with the vaccination clinic as opposed to WellPath? I mean,
So the health department has expressed a number of interest in supporting. Right now, they're still in their transitional
Okay.
stage, so to not overburden their resources as they're working on community expansion, we do still have some partners, and I think that our healthcare provider on site can also support those initiatives too. This way, it's also comprehensively added into their electronic health record while they're incarcerated as well. So I think there's a number of reasons for now that I would push to utilize WellPath for this. And in the future, we have lots of ideas with the health department, and
Okay.
they're on board, but now might not be the most supportive time for them.
okay, thank you. That's it from me.
other questions or comments from the board.
Yes, I had a comment. This is Mr. King.
Yes, Mr. King, go ahead.
Yeah, I just wanted to thank Kelly and thank Warden Williams for their collective and collaborating effort to make sure people get more reentry services proactively and and preventively, so we can make sure people be successful when they get back out in the world. So I just want to give kudos to them, and I really appreciate them diligently working on those things for the residents. Thank you.
Yeah, and I was going to make a similar comment. I really appreciate the efforts of Deputy Warden Shaw in advancing these programs. And I think it really these are both great examples of what we have been stressing since the deprivatization, which is that I think our approach is going to be that we are opening the doors to other stakeholders throughout the county who want to see the jail be integrated with what our efforts are in a broader sense of rehabilitation. We're best served when we have these outside organizations like a Penn State Brandywine who wants to work with us to put in programs like this. And I know there are a number. There's quite a list of organizations who have reached out directly or indirectly, expressing a desire to work with us. So, the more we put these programs in place after proper vetting and after proper, fleshing them out, I think we're all going to be better served by it. So these are two great success stories to get moving. And the other was just a request from a presentation perspective. I think on both the reports by our deputy wardens, I really appreciate the detail that you're providing, and last month's slideshow I think was really helpful. If it's possible to continue that, I think for the betterment of the board and for the public to be able to digest all of the information you're sharing, I think that would be really beneficial if you can.
Yeah, that's the thing we're trying to do for July because it.
Oh.
I'm sorry. This is something that we were planning on doing for July because from my understanding, you said quarterly to do a presentation like that, so,
That'd be fine.
okay.
Yeah, thank you.
Thank you.
Anything else on the warden or deputy warden reports? All right. Thank you all. I think that brings us to the subcommittee reports. Is there anything from our subcommittee chairs for today? Hearing none, we are on to the next round of public comment. Is there anything from the public for the board today? Yes, sir. Please come to the podium. Please provide your name and address, and please limit your comments to 3 minutes or less.
Yes, sir. My name is Alec Fenyes. I am a volunteer for Thresholds in Delaware County. My address is 755 Hinchley Run, Westchester, Pennsylvania. Thresholds in Delaware County has been teaching decision-making skills in a prison since 1974. Our volunteers interact with inmates on a one-on-one basis, and inmates who complete our program are 25% less likely to reoffend. We are a tax-exempt charitable organization, and we get support both from the Delaware County Foundation and the Community Foundation for Delaware County. There are two individuals, there's Michiko Warren and Heather Finnegan. I don't know if you know these two. They were very helpful with helping us raise funds. Since the county took over the J.W. Hill Correctional Facility, we have noticed much improvement in our ability to function there. It is easier for our volunteers to get cleared, and waiting time for inmates to appear for their teaching session is much reduced. I'd really like to express my appreciation to Kelly Shaw for helping us out with this particular problem. Unfortunately, for about the past 2 weeks now, we have been prevented from meeting with our inmate clients because of COVID pandemic. We request that the board take all necessary action steps to enable our volunteers to be able to function again. Also, I would like to invite all of you to volunteer for Thresholds. You will come to me. you will meet inmates, and you'll be able to see what the impact of your decision is on them. I actually have a couple of booklets here with me that describes our program. Encourage you all to look and see what we do, and please, if within your power, please allow our volunteers to continue to work with the inmates. Thank you.
Thank you, sir. And we appreciate the efforts over the many years of you and your organization to work with the incarcerated population. And we will certainly, as soon as it's safe within the context of COVID, we certainly hope to immediately allow for those in-person visits again. Thank you, sir.
Thank you.
Anyone else from the public for today? All right, hearing none. Comments from other board members? Yes, Executive Director Lazarus.
Thank you, Mr. Chair. The areas that we've been working with Warden Williams on are capital improvements. And I have asked Public Works Director Daniel Floyd to join us at the next meeting to give an update on funding and projects that are included for the prison and the county's capital improvement plan. So I look forward to Ms. Floyd coming and sharing the improvements in the physical surroundings that the county is funding and is planning to execute.
Thank you, Mr. Lazarus. Anything else from the board for today? Hearing none, I would entertain a motion to adjourn.
I'll make a motion to adjourn.
We have a motion and a second. All in favor? Aye.
Aye. Aye.
Any opposed? We are adjourned. Thank you, everyone.
Thank you.